Welcome to the Hen House Podcast, where mothers rise together in authentic conversation and sacred connection. With your hosts, Chantal Breanne and Andrea Sjoeberg. It's time to jump into the Hen House.
Hello and welcome back to the Hen House Podcast. I am so glad you're here with me today. It is just me for today. Chantal was sick this week and her kids are recovering, and so it's just going to be you and me for today. So the goal for today is I am going to talk about Webster Chiropractic Technique, and how it can help optimize things for a healthier pregnancy, labor, delivery, and all of that. And to get started, I want to reference a book just very briefly, and that is a book by Ina May Gaskin, and it's her guide to childbirth. I'm a chiropractor. I am not a birth worker. That is not my ultimate. While I'm very good, I have a lot of knowledge about a lot of things. However, I am not a midwife or a doula or an OB or anything like that. So what I do want to do is reference this book and just talk a little bit about learning to advocate for yourself and becoming really informed for yourself during your pregnancy so that you can better accommodate and hopefully get a birth experience that is more in line and more in alignment with what you are actually hoping for and wanting and desiring for yourself. And so in her book, she really talks a lot about really respecting the process of birth and giving it time and allowing it to proceed. And that and she goes through a lot of the interventions in this book, and there's a lot of other books that also go through interventions. I highly recommend childbirth education and things like that, especially to do it outside of the hospital setting. It will just maybe perhaps give you a wider range of viewpoints. But she really talks about respecting the body and how every intervention that you do has a possible effect both for yourself as the mother as well as for your baby. And, and she goes through talking a little bit about, with her experience and with the research that she cites in her book, that increasing inductions, and trying to rush labor can actually lead to a higher cesarean section rate as well. So more C-sections. And there are other authors who also talk about the cascade of interventions, that as more interventions happen, there can be more interventions that are needed. And so it's really worth a read as far as that goes, because she goes through the reasons why you would absolutely need a C-section, and then some of the reasons where you may or you may not. And it's, I think, really important as someone who wants to go into birth really informed, and especially if you strongly feel that you would like a natural or a vaginal delivery, it's important to understand that what is necessary is sometimes differs slightly or widely from hospital policy or preference. And so it's definitely worth a read. So there's the absolute reasons you need a C-section, and there's only a few. And again, it's a wonderful thing that this exists for those who truly need it. And C-section rates have gone up a lot. And as C-section rates have gone up, maternal outcomes have gone down. And this is something also worth considering. It is a major abdominal surgery if you go for a C-section or end up needing one. And it does come with some pretty significant risks. Again, especially for mothers. It comes with some pretty significant risks. And anytime you're getting cut into, especially that significantly. There are some significant risks, and there is quite a bit of discomfort and pain that can also occur for a while after your baby is born as well. And so it's worth looking at what are the absolute necessities and what are the things that are questionable, that are sometimes, and how can it be avoided. It's worth knowing that and really understanding and coming to terms with what you are comfortable with and what you would like the ultimate outcome to be. And then really doing your own research and asking questions and really paying attention to choosing a provider who is giving you accurate information that lines up with some of the other things that you're reading and with some of the other authors and peer-reviewed literature and things like that. So really, it's worth digging into it. And again, that's always your choice. But I believe it's worth digging into it and really investing some time to really understand things, regardless of who your provider is, whether midwife or OB or whoever. It's really worth knowing things for yourself so that you can have a very informed decision-making process. And that way you have a lot of the information with you, which helps you advocate better for yourself and communicate better for yourself, regardless of where you're giving birth or who you're giving birth with. It also helps you find a provider that's hopefully more in line. But again, things can be unpredictable. So you may not necessarily have the provider you hired when you actually come to the birth. And therefore, again, I don't believe that you can rely on everyone else around you to know the information and tell you the information and make the decisions for you. I mean, you can. That wouldn't be my way of doing things. So I think it's a great book. It's worth a read if you are pregnant or if you are in the birth space or if you just are interested in these sorts of things. Even if you have children and you may have another one, it's worth a read. And it's definitely, I just believe the more informed you can be and the more in alignment you can be and really trust your intuition and really tap into what you truly desire for your birth. And then go with that, because it doesn't have to be what everyone else wants. And it's okay to be different. And on that note, my hope for everyone giving birth would be that they have the experience that they desire. And I'm going to tell you a very short story because it kind of is a little bit about how this podcast got launched. I did not have the birth I had hoped for. And there was a few things that went really right. There were a lot of things that went really wrong. I did not have the provider I hoped for. And I did not even have my backup provider. And so I had just random staff when I showed up, basically at the ER, having gone into labor really early. And I felt like I was not listened to. My thoughts and opinions were not respected. A lot of the statistics that the doctors gave me, either they refused to give me statistics or information if I asked a more specific question, or they gave me something that wasn't accurate. When I looked it up later, I'm going, that wasn't accurate. In some cases, my providers flat out lied to me. And they had an agenda of pushing for cesareans and a lot of interventions. They were not patient. I felt like they attempted to sabotage my process often, and that was my feeling. I don't know what their intention was. I don't know if they were actively trying to push for something or not. I'm not sure. But I left feeling very upset. Like, this shouldn't have gone this poorly. And I feel like the added stress and the lies that I was told and the fear mongering, which in my case truly was fear mongering, was excessive and really hurt my outcome and landed me in a position of giving birth far away from what my hope had been. And I'm going, okay, I'm not happy with it. I'm actually really unhappy with it, but I can possibly get on board that for whatever reason, this is what happened with me. There were some very unusual circumstances that kind of came up, some things that were quite rare that we didn't know about going into it. Okay. And then I heard a story of a mother who had given birth, also had a cesarean, and she was sharing on Instagram. And she said that she went into labor. Her labor was progressing really well. And they came in, the staff came in and said, you know what, we have 6 other women on the floor right now who are in labor around the same stage as you, or maybe a little bit above, and we can't have more than that giving birth at any one time in our ward. So we're going to give you medication to stop your labor, and we'll circle back to you, when everyone else is given birth. So that's what they did, and her labor got stopped. Then they restarted it with, some kind of induction of some kind, some hours later, maybe 12, I think it might have been around 12 hours later is what she said. And immediately there were signs of distress and things weren't going well, and she ended up with a C-section, which, yes, in that moment may have been necessary. However, my question is, would it have been necessary if her labor had never been stopped to begin with? And I think that's a very valid question. And she left saying, no, this wasn't the birth I wanted. However, thank goodness the hospital and the staff saved me, because my body is broken. I never could have done it. And thank goodness for modern medicine. And that was more than I could take. And I said, okay, I have to start talking about something. And so that's kind of what pushed me over the edge to say, okay, I'm going to throw my voice into the mix and start talking about what we talk about on this podcast, which is mindful parenting, intuitive living, trusting your body, trusting your being, trusting the wisdom that lives within you, trusting that mind-body connection, because it's so powerful. And really both healing from birth trauma, because it does exist, and also preventing it and beginning to have a more informed discussion of it and not hide from things that don't go exactly as planned. Because I think by avoiding it, we can't be an ostrich about this with our head in the sand. We have to look at this. And it comes from, for me, a place of wanting to create birth in the beginning of life that is more positive and more empowered. If you hear nothing else in this portion of the podcast, I really would like to convey that your body is brilliant, that you have powerful intuition, and when you connect to yourself, there is so much wisdom in that, and it is something to be valued and something to be cared for. You are, without a doubt, not broken. You are whole and you are healing, and your body is very capable, very capable. And that is my message that I would really most like to convey. And in this, birth, as in life, is unpredictable, And sometimes medical intervention is truly necessary, and thank goodness it exists in those times. Sometimes it is not necessary, or at least not yet necessary, and the better thing for your body and your process would be to allow, in this instance, labor to progress and not be messed with. And again, it really is a very case-by-case kind of a situation. And that's why I believe it's good for you to have the information that you need. And also, on the flip side, I also believe this is why it's really important to provide the, so to speak, fertile ground for this desired outcome to occur within. So it's worth investing in yourself and in your self-care and in your pregnancy ahead of time so that you can offer yourself and your baby the best outcomes during pregnancy, the best outcomes during labor and delivery, and the best absolute start to your postpartum journey and their life. And this is really important. So it's how you eat, it's how you move, it's how you sit. It's the other types of self-care that you're involved with. And, there's a lot of ways that you can support yourself. It can be even something as simple as not reclining. Sit up straight, especially as you get towards the mid and later part of your pregnancy. This is better for helping the positioning of your pelvic bones, because we want the pelvic bones to be in the best position that they can be, because that helps the baby find their best position. It could be having Maya abdominal massage. And you can learn more about that in season 1, episode 8 with Charlotte. It was a great episode. Or it could be what we're going to discuss for the next few minutes, and that is Webster Technique, Chiropractic Technique. So the short of Webster Technique is it's a chiropractic technique, and it is beneficial for women throughout their entire pregnancy, can be used throughout the entire pregnancy, can also be used prior to pregnancy. There is some amount of research that indicates it is also helpful for fertility issues, as well as for menstrual cramp and pain issues. However, it's primarily used for women during pregnancy, and the goal of Webster Technique is to create a balance within the sacrum and pelvic area. And in doing this, it allows for 1, more comfort for mom, and 2, allows for baby to hopefully find their most optimal position for birth. Again, positions that are less optimal can land you in a C-section, different breech positions, or they can make labor more painful or longer. And so really you want baby as best as possible to be in an optimal position. And there are no guarantees. However, it's worth, even though there are no guarantees, I believe that it's worth investing in taking care of yourself as best as possible to give yourself the best chance to have the best outcomes. And so Webster Technique is going to focus on basically ligaments, muscles, and bony structures of the pelvis. And the goal is to balance these systems as well as the neurobiomechanical aspects of the pelvis. So the nerves as well as the biomechanics. So it deals with the sacrum, deals with the piriformis muscle, it deals with the sacrotuberous ligament, it deals with the pubic bone, with the round ligament, and with the psoas muscle is the essence of the technique. And the goal is ultimately the most optimal pelvic function for mom, because in that relationship, it allows for a better outcome for baby's positioning as well. And so again, we're not as chiropractors, we are not addressing anything to do with baby. If baby moves, which some babies do, it is only because mom's pelvis is in a better position and it has allowed for more space for the baby or the passenger, so to speak, to find their most optimal position. Because the baby is always doing their best to find everything the best that they can. And so Webster Technique is a way, and is one way of many, but very valuable way to help mom have a much happier, healthier, more comfortable pregnancy. Some women have reported shorter labor and deliveries. And it also, hopefully, as mom's pelvis creates more space and has a better positioning, the baby will sometimes also have the ability to find a better positioning as well. So that's kind of the goal of Webster Technique. It is a brilliant technique, was developed by Dr. Larry Webster, who was one of the great founders of, well, not the founder, but one of the early greats within the chiropractic profession. And it is definitely worth checking it out. If you are pregnant, I highly recommend it. And it's, again, it's not addressing the baby. However, anything that mom does that's positive for her physiology is going to benefit the baby as well, because you're a very combined grouping when you have a baby living inside of you. And so that is, generally speaking, Webster Technique. And if you are looking for a provider, the ICPA website will list all of the certified Webster providers in the US for sure, possibly in other countries as well. There are many people who do Webster Technique. You don't necessarily have to be certified in order to do it in an excellent way. However, you do definitely, if you are pregnant, ideally have someone who is Webster trained, and these are questions worth asking. Thank you for joining me today. I hope this has been fun. Chantal should be back with us next week, and I believe next week we're going to talk about gentle parenting. I believe that's the topic for next week. So thank you for listening. If you are loving the podcast, please go ahead and subscribe on whatever platform you are listening or viewing on. You can also leave us a review if you wish to do that, and always be welcome to share. And thank you for being here. We are so grateful that you are on this journey with us, and we look forward to sharing with you again soon. Thank you. Bye-bye.